Hi, my name is Dan Roeder, and I'll be presenting on the effect of music therapy on mental health, specifically focusing on adolescent health. So what is music therapy? The established health profession in which music is used within therapeutic relationship to address physical, emotional, cognitive, and social needs of individuals. And I just wanted to point out that the website musictherapy.org is incredibly chock full of information and also resources you can use in your classroom. So what's the connection to mental health? It's a clinically executed and research-based treatment option for patients who are resisting other treatment options like face-to-face therapy. It does require, at a formal level, certification from the MTBC, and that's the Music Therapy Board of Certification. You need to get a BA in it first, and then if you want to become certified, it's incredibly rigorous and competitive. Music therapy is based on individual assessment and features tailored treatment plans, and I thought it would be really great to pair with special education, which also is very individualized. And I think one of the most important things to understand about musical therapy is that it uses musical interventions to work on non-musical goals. It doesn't work on musical skills. It uses those skills to address other issues. And it's best suited to treat the needs that are psychosocial, physical or motor skills, cognitive, and communicative. So we're going to dive into each of those right now. Social and emotional needs can be addressed through musical therapy, especially with behavioral intervention. Let's say you have a student who has an undesired behavior and you want to replace it with one that is more socially acceptable. So you can create a simple musical cue like, "we shouldn't do that," and then that will just cue the student every time they're engaged in that behavior. And through use of a mnemonic device, you can over time change that behavior. Music therapy can also integrate marginalized students by creating a common ground. And you can also model feelings and social conventions for especially students with autism. This works great. For example, using feeling songs. And one thing to point out is it's not limited to just positive feelings and saying, you know, if you're happy and you know it, clap your hands. But it's also, you can find or create songs that can just help you identify how somebody is feeling. That might be somebody's goal to, just identify how they're feeling and work through their emotions at whatever level they need to, and music can help that. Physical goals, drumming can help with rhythmic coordination, cross-lateral patterns, which just means going across the body over the midline. Help with timing, and you can actually physically modify your heartbeat if you get into a rhythmic groove and slow yourself down or speed yourself up depending on what part of your day needs. You can work on gross motor skills and spatial awareness. Learning an instrument like oboe, flute, clarinet, anything like that, you can really hit those fine motor skills and coordination. And then vocally, you can promote vocal health and also improve lung capacity through use of breath exercises. Cognitive goals. Cognitive abilities are brain-based skills that we need to do anything in life, ranging from simple to complex. And neuroplasticity is one of those giant rabbit holes that I found while I was doing my research that I kept diving down. And I'm not going to do that in this presentation, but you're certainly welcome to. And down below, I gave you a whole bunch of information about what parts of the brain do what, and I think it's incredibly interesting, but not really in the scope of what we're talking about right now. So receptive language and expressive language are two branches that any speech pathologist or speech therapist would use to talk about speech goals. And musical therapy can help with receptive language by developing and reinforcing connections and meanings, and that can be applied to meanings of words, meanings of phrases, meanings of actions. You can just associate some kind of concept that you're trying to clear up the meaning of with a musical phrase, and you can use music as a vehicle to facilitate that understanding. And then expressive language, music can very easily communicate mood. So let's say you want your student to tell you about their day using a song title. And depending on what song they tell you, you know how their day is going. It can also set the stage for collaboration and social interaction with peers. The effects of musical therapy, I'm not going to go through all of these because I really kind of highlighted those in the last segment, but basically you can use musical therapy to change your channel, whether that is making positive changes in your mood or emotional state, or developing coping and relaxation skills. I like the terminology changing your channel because it identifies that power that music has as a way to move from one idea or concept or feeling to another, and by bridging those two things. So I'll let you read through the rest of these reviews of what music therapy can do, and then I also wanted to just give you a couple of studies, one nature, one nurture, about the power of musical therapy. I'm not going to dive into those, but I've found them incredibly interesting, so I highly recommend you read those if you're interested in this. And then, of course, here's a whole bunch of other information, and like I said, there are so many things that you can do with this and so many directions you can go. I tried to keep it brief. I did this I did like 16 takes of this, and my longest one was like 17 minutes. So you're welcome for it being this short, and have a great day.